I think this means we're ready to go. Okay. So my name is Linda Nilsen. I'm the Executive Director here at Project Access Now, and it is a pleasure and an honor to welcome you all to our space. Thank you. I especially want to thank Barry, Leslie, and the staff of DCBS, and because Barry said, I was trying to think who has space and is crazy and will follow through, and apparently that's us. So very grateful for that. Also, we have board and staff. If you guys can just raise your hand, let folks know where you are. Very, very proud of our board and staff. I have three people specifically that I want to call out. First of all, I want to call out Janet Hamilton, who I saw over. So Janet is our deputy director, and she also goes by fomenter of chaos, and every once in a while, Peaches. And then also Jonathan Sauerwein. I think many of you know Jonathan and his team. He's got a team there. We have a program called Outreach, Enrollment, and Access, and that's the program that has interfaced most with this work. And so great work done by those folks. So thanks to Jonathan and his team. And we also have one of the folks on that team is Sean McNulty, and other people here who are a part of the Health Insurance Exchange Advisory Board. So I'd like all of you to raise your hand and give a little hello. So our mission at Project Access Now is to improve the health of our community by creating access to care and services for those most in need. Pretty lofty goal. Personally, I have more than 25 years in public health, healthcare delivery, both domestically and internationally, and in preparation for this day have taken some time to really reflect. And we've come a long way in 25 years. How many remember the Cover the Uninsured Week? Do you guys remember that? The Cover the Uninsured Week? Okay, that was a big thing for a lot of, because there were a lot of uninsured. There aren't as many uninsured now. And I also have to say, because of what we do, that there still are uninsured among us. And really, I think what pulls all of this together is all of us are here because of our commitment to community health. We want to have a healthy, vibrant, thriving community. So what that means is coverage matters. It also means that access matters. It means that social determinants of health matter, which means income and race. All of these things matter. And all of us are really fortunate to be in Oregon. We do a fair amount of work with other organizations across the country, and whenever we have to go and talk to people, we are always reminded of what a great environment we get to work in. So for those, even though it's hard and frustrating at times, I want you to know that you are in one of the best places in the country to be doing the work that you're doing. And we all have a role to play in this. I would say all the way from the governor's office to the navigator that's working with the children of an incarcerated parent to make sure that they get the services they need, everyone has a role to play. This is hard work. There's a sense of urgency because there are real human lives that are in need right this moment. And at the same time, we have systems that are not functional, quite frankly, dysfunctional. And so we need to do more than one thing at the same time. And we are really proud to be a part of working on that, working all up and down the public health stream, so to speak, with many of you in this room and many who aren't here today. So we are really grateful for that. And the way we look at it is that we want to take these community health visions and turn them into community-wide solutions. And many of you in this room are a big part of making that happen, so thank you. Now, it is my great honor to introduce Governor Kate Brown. I think that leadership, the tone of leadership is very important, and Governor Brown has come in and set a tone around health and community health that is very important. It's very holistic. It recognizes that health is more than just access to health care and that our lived experiences impact our individual and community health. It's with great pleasure that I introduce Governor Kate Brown.
Well, a special thank you to Linda and her team for hosting us at this great event. Can we give a round of applause to all the folks at Project Access? Yay! Woo! Well, as an Oregonian, I am so proud to be here today with CMS Administrator Andy Slavitt, to reflect on the great success we've had in Oregon over the last handful of years and to gear up for the upcoming enrollment season. Healthcare reform is working in Oregon, and I am so very, very proud. Yay! The numbers are startling. Just a few years ago, 15% of Oregonians lacked health insurance, many of them low-income families and vulnerable populations. Today, about 95% of all Oregonians and 98% of children have access to health care coverage. Yay! Leaves a little work for the 2017 session to make sure that we get all children covered. Are you guys with me? All right. You too? More than 400,000 additional Oregonians have gained access to the Oregon Health Plan, and 130,000 Oregonians have enrolled in insurance on the marketplace, where they have access to financial assistance. Many of these individuals have not had access to health care in years or decades, and it is significantly impacting their lives. We're going to hear some of those stories today. Before health care reform, too many Oregonians had to decide between suffering from injury or illness or going to the doctor or emergency room but facing bankruptcy in the process. Today, rather than just relying on emergency rooms, these individuals can go to the doctor and get preventative services like contraceptives and cancer screenings. Yay! But the most important part is that it couldn't have happened without you, without each and every one of you in this room. The real reason behind our success is the commitment of our community partners, agents, volunteers, and advocates who work every single day to help people enroll in health insurance. Thank you so much for your extraordinary efforts. Your work is having an impact on thousands of Oregonians across the state. Well, we certainly have a lot to celebrate today. We still have more work to do. Open enrollment begins on I don't know, could you hear them? I couldn't hear them. Open enrollment begins on November 1st, just a few days away, and it's time for our consumers to choose a plan and enroll in health insurance coverage for 2017. Where should we go? Healthcare.gov is the place to compare options, enroll, and find out if you're eligible for financial assistance. And for those who are still uninsured, now is the time to get enrolled. Last year, your efforts, the team efforts of everybody in this room, led to a 31% increase in enrollment in the marketplace. 31%. Yeah, that's incredible. It was a bigger increase than any other state using healthcare.gov. So let's do the same again this year. Yay! So we have to keep the momentum going. We have to continue our efforts to reach those Oregonians without insurance and help connect them with the plan. But our success in Oregon is definitely a community-wide effort, a local effort, and it also takes a great partnership with our federal partners. We've been so incredibly fortunate to have Administrator Andy Slavitt with us this week to celebrate Oregon's successes and to set the stage for the next phase of our work. We will continue to work tirelessly to ensure that all Oregonians in all parts of the state are healthy and can thrive. But his visit is a testament to Oregon's role as a national leader, and we look forward to continuing our partnership with CMS to improve the health and the lives of all Oregonians. So please give a very warm Oregon welcome to CMS Administrator Andy Slavitt. Yay!
Thank you. Thank you. I didn't know the governor was giving out high fives. That is good. That is great. Well, it has been such an honor to spend the last couple of days traveling around Oregon, visiting communities, and marking the progress along with the governor and her great team that's occurring everywhere. And I will echo the governor's comments that it's really due to the community here, the physicians, people assisting consumers and patients, hospitals, the health plans, and all the organizations that are really working together. And I will tell you specifically that here at Project Access Now, all I can tell you is I wish that every part of the country were lucky enough to have a Project Access Now where they are. Although if I'm right, I think it would have to be called Project Access something else, right? Because now is Northwest Oregon and Washington. Is that right? Used to be. Now just means now. Now just means get it done. Well, great. So let me talk a little bit about open enrollment and what we're all about to embark on. And I can tell you that we are extremely excited and optimistic about what's ahead. First, I'll give you a little bit of picture of what's happening at the federal level very quickly. For years and years and years, we have all seen the same problem and looked at the same problem over and over and over again, which is that as good as our healthcare system is for some of us, it wasn't delivering what it needed to deliver for many of us. And with uninsured rate at 15% plus, since going back as far as most of us can remember, to sit here today and see that we have nearly cut the uninsured rate across the country in half is truly remarkable, 8.6%. And look at the newspaper. It takes courage because guess what? There are people who, for some reason, aren't as excited about that progress as the rest of us. And I think it's really important that we understand and face up to the fact that we need to stay focused on people and their families and getting the job done for them. So what's next then? With this uninsured rate, there are still people who are not getting access to the care they need across the country. Three general pockets of people. There's the working uninsured, the working poor, who in many states in this country are denied access to Medicaid because their states have not expanded Medicaid expansion. We are much more fortunate here, still in all. This is a state that's not resting on what is done in Medicaid, but is reinventing what happens in Medicaid. And I've gotten to spend the last couple of days looking at all the advances that have begun and that need to continue here in the state. And I'm excited for us to continue to play our role as a partner in moving forward with reviewing and making sure we have a good outcome for the waiver request that's come in. You can clap if you want to. Secondly, we have pockets of chronically uninsured individuals in communities all over this country and all over the state. So here in Oregon, you've reduced the uninsured rate by 48%, but there's more. And finding those folks and making sure they understand the very simple point that for over 60% of people in Oregon that are uncovered, they can buy a policy with their tax credit for $100 or less. 62% of folks without coverage can get access to a plan for $100 or less. Not only that, but we estimate that there are 26,000 people in Oregon today who are buying a plan off the exchange that are eligible for a tax credit and don't know it. So they can be saving money by coming to the exchange. So we have an education opportunity. What we find, interestingly enough, across the federal level when we look at data is that the lion's share of people that are eligible for a tax credit don't know they're eligible. They may even know that there's such a thing as a tax credit, but they don't believe they qualify. So this is where our opportunity is here. And I think the third group of people that I think are just critical part of the economy here are people that are part of what, not my phrase, is known as the gig economy. This is the economy that allows people not to be tethered to their employer, not to be tethered to the old way of doing things. And this is allows millennials to be entrepreneurial, to work in other kinds of jobs. And we announced this week 17 partnerships, including with Uber and Lyft and many other organizations, gamers and all kinds of cool stuff to reach out to and connect to those folks. So I will tell you just, again, just to go back to the point of not everybody, as much as you can, it's hard to imagine, not everybody sitting here today is focused on how do we make sure people get the information they need and get covered. So there are headlines. The headlines say what? Headlines say double-digit rate increases. So let me spend a second talking about what the facts are. So last year in Oregon, there were headlines about double-digit rate increases. Okay, so what actually happened? So for the 71% of Oregonians who are eligible for tax credits, their rate increase equaled 4%. 4%, or $6 per month. So understand that those headlines, the same headlines we see this year, are going to be very different from the reality. Secondly, for people who came back to healthcare.gov in Oregon and shopped, they saved $432 on their plan. $432. So the opportunity to take advantage of the tax credit and to shop means that for the vast majority of Oregonians, and certainly the vast majority of people that you're going to interact with, that's irrelevant. Those numbers, those headline numbers, are just theoretical. Because why? The ACA was designed to protect people when rates, in years when rates went up. Doesn't mean healthcare is not too expensive. Doesn't mean we don't have to focus on things like prescription drugs. But it does mean that we are able to protect consumers, and we need to get them, certainly get them that message. So with that, I think it is my job, my duty to introduce some of the consumers that are have benefited from and are benefiting from the exchange here in Oregon. And I think, I'm not sure I know their last names, but I think I was told to introduce Marianne and Jason. Is that right? Did I get that right? Miriam? Miriam and Jason. Thank you very much.
Hello, everybody. My name is Jason Lavery. I am also an artist who goes by the name Dizzy Orion. I am a self-employed single father, and for a self-employed single father, I couldn't be more average, which means that I'm one medical emergency away from a financial catastrophe. In 2012, after paying my existing premium for virtually my entire adult life, I had appendicitis. And 2 weeks later, I went to the mailbox and I got a bill for $10,000. So I didn't exactly have that laying around, you know. So, it just made me wonder, what am I paying for? A few years after that plan had kind of gone away, and I didn't know what to do. I had been on the phone with provider after provider. I ran out of cell phone minutes. When's the last time you heard somebody say that? And thankfully, through getting in touch with the community outreach program, within 48 hours, I was covered. My son was covered through OHP. And now I don't have to play roulette with our health anymore, you know? And it's just such a liberating feeling. A good friend of mine used to say, you got to put the oxygen mask on yourself first. As a parent, our instinct is to take care of our children. So naturally, I would do that. But taking care of yourself is taking care of your kids too. And now I don't have to make that choice anymore. I can get in the truck and go to the doctor. So I can't thank you all enough for what you've done for me.
Good afternoon, everyone. Thank you for inviting me and my family to share our health insurance story with you today. I want to introduce you, my husband Cam, my children Jahan, Kian, and my mom Valia. I moved to the United States in 2007 from Austria, where I joined my husband, who also immigrated from Germany in 2000. We also moved my mother from Iran here to live with us in 2010. Everyone in Austria, Germany, and even Iran has a government-sponsored health insurance, and we were surprised when we moved to the United States and learned that the system is not the same. I met Jennifer Allen, who is a health insurance agent in Portland area 3 years ago. Jennifer told me about the Oregon health plan for my children and about subsidies available for me and my husband and my mother. At that time, we signed up for those plans she recommended. My mother had a heart attack last April and ended up with $50,000 in medical bill. This could be a very stressful situation for us when we didn't get appropriate health plan for her, which was recommended by our agent. We can now seek routine medical treatment, and we also know if one of us become very sick, we don't have to worry about facing major medical debt. We can't thank Jennifer enough for all her help and support, and we are so glad to have the ability to be recipient of how the Affordable Care Act can help people. I believe that healthy families make a healthy world, and we are grateful to have help being healthy. Thank you.
I'd like to say a special thanks to Jason. A special thanks to Jason and Miriam. It is not easy to come up in front of a group like this. And I really honor, I've had a chance to tell them both before, I want to say it publicly, really honor and appreciate your courage and your willingness to share with us really personal information. And it helps all of us understand what a real impact this is making in real human beings' lives. So thank you so much. One more round of applause, Ben. And I'm taking the opportunity to make one more shout out to insurance providers and insurance agents. I think particularly in the insurance agent, we work with insurance agents, and not all insurance agents are doing this work. And I really want to say to those of you that are engaged, thank you. It really makes a difference. So you're welcome to stay around, and you're welcome to stay around. We're going to do some photos, but please mingle and enjoy. Thank you.